Places for natural healing. So tonight we're going to be talking about quantum nutrition testing, QNT, radiation, and joint pain. So quantum nutrition testing, what is it? It is a unique technique that allows practitioners and people who are certified in quantum nutrition testing to be able to assess areas of the body that are working optimally and the areas of the body that are not working optimally and find out the underlying cause. And these causes can actually be missed by traditional Western medicine testing. So, as a nurse practitioner, I 100% agree with this. Seen it myself, in practice, both as a holistic and regular in the regular Western medicine world. So, one of the things that a lot of people do is they go through Western medicine testing. They might not feel so good and they wind up, being put on medication to control the symptoms. You have a headache. Well, we don't know the reason. And so we're giving we give you a medication to help with the headaches or the migraines or whatever it is that you have. So, or you have anxiety. Oh, well, your labs are fine. And I'm sure some of you guys have seen this or heard of this, where labs are okay. And thank you for joining. If you guys are anywhere in the area or whatnot, would love to hear from where you guys are at. But we are streaming live from the Chicagoland area. Anyway, so yeah, and you wind up getting labs, and the labs are okay, and they're just they tell you, hey, we don't know why you have these symptoms, or it's just anxiety, or it's just whatever, or they give you some goofy explanation, and we don't know the reason. Here, have a pill. Okay. But with quantum nutrition testing, we can actually get to the root cause of why you have your symptoms. And we actually have virtual and in-person patients too. And one of the things is that one of the hidden causes of why people, and we're going to talk a little bit about joint pain and chronic pain tonight. And one of the hidden causes can actually be from radiation. Okay. So, and I can't remember exactly the article that I read, but it stated in the article that by the time kids nowadays, by the time they hit in their mid lives, like 40s, 50s, they have been exposed to enough radiation to, like, as an atomic bomb. That's one of the articles that I read. I was like, oh my gosh, that kind of actually makes complete sense. So where are some of the things that we can get actual radiation from? So, which I'm sure that some of you guys are using right now, is the Bluetooth devices. So that's giving off radiation. All the 5G towers, that is giving off extreme amounts of radiation. So the laptops, your earbuds, and you're actually putting that right by your head. And some women, and radiation is known to cause cancer, also joint pain too. So a lot of people with unknown reason why they have pain, or they've been diagnosed with arthritis or rheumatoid arthritis, that could be also a result from being overexposed to radiation. But some women will put their cell phones, and I was, I did that too. I put my cell phone in my bra, especially if I needed both hands and I didn't have a pocket on. So we shove it right in our bra, and you're actually putting radiation right on your breast tissue. You are exposing your breast tissue to radiation, leading to cancer, and it can lead to enlarged lymph nodes, other diseases as well. And there are research articles that overexposure to radiation can lead to, so this might be why you have autoimmune disease. Anybody who has an autoimmune disease, Hashimoto's, and other diseases, chronic fatigue, radiation exposure, such as from your cell phones and other things, can actually cause thyroid issues. So being really, really tired and really, really fatigued. Okay. So maybe you have undiagnosed anxiety, or maybe there's no cause for your anxiety. You just feel anxious and the doctor just wants to give you an anxiety pill. Okay. Maybe you've been exposed to some radiation. Radiation, we know, can negatively affect the thyroid. So we know that. And radiation can negatively affect your joints. So I've seen it so many times, unexplained pain. X-rays look okay, or maybe even if they don't, and you're diagnosed with arthritis. So joint pain, unexplained thyroid issues. So can be from radiation. We can have radiation from natural sources. The earth gives off radiation. That is a natural source. You cannot escape that. Okay. But the other things, so if you don't have an EMF protection, I would highly recommend that you get an EMF protection. So there is QLink. There are some other good. I will actually, when I'm done, I will post this on Facebook and on my Instagram on some other things where you can get, an EMF protector that you can actually put on your cell phone, put on your laptop. You can wear some of these. You can get a whole house. People who have not been able to get a good night's sleep, they put an EMF protector in their house. Guess what? They're sleeping. Their energy levels improve. So, but the other thing is so that helps to your body to not absorb as much of the radiation, but then we also need to get it out of our bodies because you've already been exposed to it. Okay. So, how do we do that? How do you get rid of the radiation? How do you help handle your symptoms naturally and get to the root cause? Okay. So, and that's what we do with quantum nutrition testing. It allows us to find out why you have your symptoms. Oh, and by the way, and diabetes can actually be from overexposure of radiation. It has been known to cause insulin level increases too. So your unknown reason why you developed diabetes, could be also from radiation as well. All right. So radiation can actually cause a lot of different symptoms. All right. And again, we don't want to just mask your symptoms. We want to get to the underlying cause. Why do you have your symptoms in the first place? And this is one of the things that we actually do. So we get to the root cause. We want to find out, is it from radiation? Maybe it's from something else. Maybe it's from food intolerances. Maybe it's from actual parasites. What is the underlying cause of why you have your symptoms? And quantum nutrition testing allows us to do that, and allows us to do that actually virtually, believe it or not, or in person. So, and then we can find out exactly what supplements your body specifically needs. Now, how cool is that? Rather than actually taking a guess at, like, I don't know how many times I've been to the store, and to like GNC or to Whole Foods and looked at the supplements like, good Lord, like there's so many. How do you choose which one? And every single one says it's the best one out there. Well, how do you know what your body actually needs? And that's what quantum nutrition testing allows us to do. Now, what's kind of cool is that you guys can actually learn how to do quantum nutrition testing as well. And some people don't want to become a practitioner. They don't want to like really see, but it would be nice to be able to help your kiddos. Like maybe they have a fever at night. Like you want to know which supplement to give your kiddo, if they have a fever, or if they have an upset stomach, or maybe you're not sure exactly which thing you need or which is the best, even like as goofy as it sounds, you can actually even use quantum nutrition testing to test to see which brand of deodorant is the best one for you, or which brand of toothpaste, or what's going to be the healthiest thing for you. You can actually quantum nutrition test all of these different things, which is and it's outrageously accurate. It still amazes me to this day. It still amazes me to this day on how accurate this is. And I've been actually surprised a couple times, even seeing like I'll be seeing a patient and they will not tell me like certain symptoms that they're having, and I quantum nutrition test them and I come back and I'm like, oh, are you having problems with such and such? And they're just like, oh yeah, how did you know? I'm like, that's how accurate this is. It literally, you can't hide from, pretty much anything. We get to the root cause, and that's what's kind of cool about quantum nutrition testing. And you guys can learn too. So, there is a quantum nutrition testing academy. I'm actually finishing. So, I've been certified in a couple different techniques with muscle testing. One is called nutrition response testing. I've taken classes through Cellcore. Cellcore is a fantastic supplement company, and they have their own muscle testing uh, program. So I've taken that, and then I've gotten certified in quantum nutrition testing. They have 3 levels now, and they just came out with the third one. And I am finishing up level 3 this weekend, actually. So I leave actually bright and early in the morning, and level 3 is Friday and all day Saturday. And I will be flying back home Saturday night and bright and early back in the office on Sunday to see patients. But there's 3 levels for quantum nutrition testing, and they're actually having one for pets. So you can learn how to quantum nutrition test your pets as well. So, and maybe to help your dog, your cat, your horse, your bird, your guinea pig, whatever animal that it is that you have. And if you want them to have a better, healthier quality of life, you can actually learn how to quantum nutrition test your pet. So, and give them the correct supplements to help them heal. So, I don't know about you guys, but my journey on holistic health actually started with my pets. So my pets they're my kids, right? Most people feel that way about their animals. Their animals are their fur babies, and I've seen so many people do so many things. They could like I could have had my arm severed off and like hanging by a thread, but and don't worry about me, just take care of my pet, and it was all about my animals, and I don't know if you guys are the same or not, but I was definitely in for the all about my pets. And my pets actually are the ones that actually pushed me into doing holistic health. And it was my dog, and this was years ago. He actually had he was my happy-go-lucky puppy, and all of a sudden started having behavioral issues. And we couldn't figure out what was going on. I saw a vet who did nutrition response testing. I didn't know it at the time, and she had just literally started doing nutrition response testing. And I had her do blood work on him because I was thinking, it was his thyroid that was going to be an issue. And his thyroid levels came back normal. So, and I'm sure some of you guys have heard of this, their labs are normal. But it was on the low normal side. And I kind of thought about this, and I talked to my aunt who was a dog trainer at the time, or she still is, and a very good dog trainer actually. And I mentioned it to her, and she's just like, send his blood work out to Dr. Gene Dodds. Dr. Gene Dodds is a veterinarian out in California, and Dr. Gene Dodds studies relationships between thyroid and aggression issues between pets. And so I had them redraw his blood work, had the blood work sent out to Dr. Gene Dodds all the way out in California. And she calls me back several days later, and I have a consult with her, and she's just like, well, his thyroid is being affected, but you're not going to find your answers in Western medicine. And I was like, now, mind you, I was a cardiac ICU nurse at the time, really wasn't into holistic health, didn't really kind of believe in this. I thought this was a whole bunch of like nonsense and voodoo-ish, and like, okay, this just isn't going to work. I'm like, you can't heal from eating berries and leaves and, roots and stuff like that. That's dumb. That's what I really thought. And she's just like, and this is a scientist, a veterinarian who studies the relationship between thyroid and behavior. And she goes, no, you're not going to find your answers in Western medicine. You need to bring your dog to, I would look up a Chinese veterinarian, somebody who studies Chinese medicine, and bring your dog to see them. I was like, now how the heck, and that was pretty much the end of the conversation. I'm like, now how the heck do I find a Chinese medicine veterinarian? So I come back to my vet, and my vet at the time goes, "Oh, I just got certified in nutrition response testing." And I'm like, "Okay." And she goes, "Well, this might help find the root cause." I was like, "All right, I guess we could do that." And so when I first saw this being done, oh my gosh, I'm like, "Oh my gosh, I can't believe that they're doing this to my dog." I'm like, because now in traditional Western medicine, or I mean, like traditional muscle testing or a nutrition response testing. So what we do is like, so somebody holds out the arm and you actually press on different acupressure points. So every single organ has its own set of nerve endings that go to the skin. Okay. How do we know this? Well, two things. Number one is that if I put electrodes all over your chest, like for in a heart monitor, okay, what does that heart monitor do? That heart monitor is actually picking up nerve impulses from the heart. And then we get the heartbeat on the heart monitor. And I can say, whether you're in sinus rhythm, whether you have AFib, whether you're having, VTAC, I can tell you what rhythm you're in. Why? Because those electrodes that we put all over your chest are picking up the nerve impulses from the heart. Okay. And then they also did studies, and this was like on PubMed. I read this a while ago, so I can't exactly remember verbatim on what was in the article, but it basically was like this. So they stuck a guy underneath an MRI machine, took a picture of his brain. Then they pulled him out, and because they wanted a baseline, and then they stuck, acupuncture needles like on different parts, like in the arm, let's say. And they wanted to see if that would actually stimulate different parts of the brain that were associated with that acupuncture point, which then was associated with different functions of the body. So they put the acupuncture needles in. And I think they left them in for like 15, 20 minutes, took them out, stuck the guy back underneath the MRI machine. And lo and behold, that area of the brain lit up like a Christmas tree. So we know that acupuncture points actually do, in fact, stimulate different parts of the brain, which controls basically your organs. So we know that acupuncture points really work. And they've done numerous studies since then, and on different, like, on how acupuncture can help, like with AFib and other things like that. So every single organ, according to Chinese medicine, and so far what's been proven, has nerve endings that go to the skin. Okay, these are your acupressure and acupuncture points. So now in traditional muscle testing and what we do in nutrition response testing, now mind you, I've been certified in several different techniques. So this is one of them. So when you're in person, so in for nutrition response testing, we can only do that in person. Okay. Quantum nutrition testing allows me to do it virtually. As goofy as that sounds, it does. So, and believe it or not, so this is what actually happens. So I touch different parts of your body. These are the acupressure points. I actually use your arm. Okay. Now, actually, I'm going to backtrack and kind of talk a little bit different. So let's talk about hypothermia and what happens when you get cold. Okay. When you're standing outside and you actually are starting to shovel snow, what gets cold first? Usually your fingers and your toes get cold first, right? And why? Okay. Some of you guys, well, because it's the furthest from your heart. Well, part of it. So think of a water balloon. If I squeeze one end of a water balloon, where's the water going to go? It's going to back up to the other end. Okay. So what happens when you get really, really cold, your body actually starts constricting blood vessels, not completely. It doesn't want to cut off circulation completely, but it slightly gently constricts blood vessels in your fingers and toes. Well, what's that going to do? Your blood is going to start backing up your leg and backing up your arm. Well, what's it going to do? It's going to pool all right in here. What's right here? All of your major organs are right here. Okay. And the body, people forget, the body is actually very, very intelligent. Whether you believe in God or not, I do. So, I'm going to say this. So, God gave us this innate intelligence inside of our body. Okay. So, our body is extremely smart. So it has this innate intelligence to keep us alive when it's functioning properly. It wants to do everything to make you balanced, to make you centered, to be accurate. You don't want your blood pressure dropping too low or too high, so it's going to make the appropriate adjustments. Well, when you get cold, the same thing happens. The blood vessels start constricting and it pools blood here because the body knows what's more important, your fingers and toes or your organs. Your organs are more important. If your fingers get frostbite and fall off and die, you're going to live. If your internal organs get frostbite and fall off and die, you're kind of screwed. So, and the body knows this. Okay. So now we're going to take back like the acupuncture and we're going to kind of put everything together. So now technically, so when you're in person and everybody, I love the look on everybody's face when I actually do this in person, because they're just like, oh, that's so cool. Like it like as if it's magic. So, and what I do is I actually use your arm and then I touch different parts of your body. And what happens is if that organ that I'm touching different parts of your body does not have enough energy to sustain itself, because remember, everything has energy. This is physics. This I'm not making up. Everything is made up of energy. Physics proves this. Energy cannot be created or destroyed. So your organs have energy too. Okay. So when I touch different parts of your body, these are the acupressure points and associated with an organ. If that organ does not have enough energy to sustain itself, your arm actually drops. It doesn't become like a limp noodle, but it'll go from here to here and it's going to drop. That lets me know that that organ does not have enough energy to sustain itself, whether you have normal lab levels or not. And even if you don't have any symptoms, because this is also about prevention. Most people wait until like they're falling flat on the ground and their symptoms are out of control. Okay? This allows us to catch things. This is preventative. This allows us to catch things before they're even an issue. So whether you have symptoms or not, your body's going to let me know, hey, I'm not functioning right where I need to be. And so, and then the question is as well, why? Why are you not functioning? And there's different things that we can use to determine the underlying cause, then to find out exactly what supplements your body specifically needs. And so it becomes a very tailor-made program for that individual. So instead of putting patients on protocols, we actually will find out what your body actually needs. Now, that's pretty kind of cool, because I don't want to be compared to my mother or my brother. I don't want to be on the same protocol, taking the same dose, because what happens if my body only wants one pill, or one supplement, or a couple drops of a liquid herbal supplement, instead of like 10 droppers or 10 drops, maybe my body only wants 2 or 3 drops. So it gets actually very specific for what your body actually wants and needs. So it literally takes the guesswork out. So I don't do protocols because it's extremely tailor-made for every single individual person. And that's what's kind of cool about this. And again, I use different techniques depending on where the person is at. If they live close by and they want to come in, then I use one technique. And actually, I kind of do a combo of all techniques, no matter what. And then if you live further away, I specifically use cell course techniques and quantum nutrition testing techniques as well. So I use a combination of those to kind of figure out the underlying cause, whether you live close or far away. So, and again, like I said, why mask your symptoms? And if this is something that you're interested in doing, even just to kind of quickly figure out things that maybe your kiddos need, or maybe, your pets need, or whatever, you can actually learn how to do this too, if you just kind of want to do it just to kind of better your family's health. And I will be posting a link in the comments section in just a little bit. So stay tuned to that. And you can kind of join. So how it works is, and I think, so this month, you get to learn all the material. You get it online. If you want to be actually certified, you have to go in person. But you don't have to necessarily, if you just want to learn the technique yourself, and you want all the material ahead of time, you can join for like, I think it's $99 this month. You can stop at any time, but you literally get all the learning material. And to actually be certified in person, you have to go in person to Florida for that. And it's a 2-day workshop. Level one, don't quote me. I think it's a little over $500, but that's a 2-day in-person workshop. That's not really that expensive at all. And it's completely well worth it, especially, or maybe if you are a person and you're tired of your job, you were looking for something different, or maybe you're looking for something as a side. Maybe you want to start cutting back on what you're currently doing, or maybe you're a health practitioner and you're just stumped on what to do with your patients. Like, you want to make a difference. You're just not really seeing that this is giving the results that you want, what you're currently doing, and you want to add something in that truly makes a difference. Now, on average, my patients, and granted, there are a couple that are a little bit less, but on average, on the whole, my patients have anywhere from a 25 to 50% improvement in their overall health within just 3 months. So, and that's pretty darn big. So 25 to 50% improvement of their overall health in just 3 months. And that's the kind of difference that we're making. Now, is everybody going to be 100% fixed in just 3 months? No, this is not a band-aid. Healing does take time. Okay. So 3 months is not enough time for your body fully to heal. For instance, like if your symptoms are related to your liver actually, the liver cells live for 300 to 500 days. That's not 3 months. Okay. 3 months is 90 days. All right. So if your liver actually is stressed out and that's the reason why you have your symptoms, you are going to have to give this some time. Okay. So liver cells live for 300 to 500 days. So that's, over a year that you might not be fully 100%. But like I said, on average, most of my patients have anywhere from 25 to 50% improvement in just 3 months. Now, I have more patients that are over 50% than are under 25%. So, and if you're a practitioner, this would be, I mean, can you imagine making that kind of a difference? And patients are able to decrease their medications because they're feeling good. I don't actually, I don't deal with that. I have them kind of go see their practitioner and their family medical practitioner to and discuss with that, on the best course of action to come off of their supplement or to come off of their medications. But a lot of patients are able to decrease their medications and in some cases completely come off of their medications, and that's pretty fantastic. So again, check the comment section. I'm going to be posting that if that's something that you're interested. If you're interested in becoming a patient, please give us a call. We're actually doing a special tonight, or I mean, for the month of December. It's a Christmas special. You get a consultation. It's 2 appointments for 99, and it's normally 250. So you get 2 appointments for 99 for the month of December. And HSA and FSA accounts do pay for office visits and supplements. All right. Have a nice night. Bye, guys.